let's start the show. MSNBC's Ali Velshi did a really great interview recently that I'd like to highlight. He talked to abortion care workers, and it focused largely on the availability of medication abortion, which is a safe and, okay, new mic is presenting minor issue. Right. Yeah, there's going to be some bugs to work out. It's a new channel. He focused on medication abortion, which is a safe and a lot simpler, a lot less embarrassing way for people who can get pregnant to get abortions. It's particularly relevant given the current state of politics, wherein a popular scapegoat for the right are people who are seeking abortions. They are fine ruining lives in the name of pleasing a constituency that they lie to and distract with issues that they feel they can get people riled up about. Here is MSNBC's Ali Velshi interviewing these workers. Let's listen to what he's got to say.
Joining me now, Robin Marty. She's the operations director for the West Alabama Women's Center. She's the author of the book, The New Handbook for a Post-Roe America. Also joining us is Janice Fountain, the executive director of the Yellowhammer Fund, a reproductive justice organization that serves Alabama, Mississippi, and other states in the Deep South. Good morning to both of you. Good to see you again. Thank you for being with us.
It's good to see you again, Ali.
Robin, when I was with you at your clinic, you told me that it has become very hard in your state to direct women to places that they can actually have an abortion procedure done, and that they were making it hard for you to even sort of imply and suggest to women how they would get a medicine abortion.
Yeah, that is true. And one thing that I can say is a positive outcome of the Attorney General basically threatening any pregnant person with prosecution is the fact that at our clinic, we've decided that we are no longer remaining silent about where a person can obtain an abortion. We are letting people know that there are websites like Plan B where they can go and look up information to be able to obtain medication abortion, even in states where abortion is illegal. And we are saying that that is our freedom of speech and something that we are allowed to do, despite his claim that that would be considered a conspiracy.
Denise, let me ask you about this. What did the Attorney General call it? The chemical endangerment law. This is actually a law that's not meant to be about abortion at all, but it's actually been used in Alabama to target women before.
Okay. So, again, be kind to Ali Velshi here. I was working in the news industry when the cultural switch happened to start saying people who can get abortions as opposed to women. I got a call. No, there's not a newsletter that goes out to all progressives everywhere. A lot of times we do things culturally that we don't even think about. And I got a call from somebody asking about an abortion story. And they were correcting me over the phone. And I was like, I was just baffled by what they were saying. I couldn't fathom it. And I said, I'm pretty sure I used the right words. Yeah, women are the ones that get abortions, obviously. And then about 10 minutes later, it clicked. Oh, yeah, trans people exist. Well, so Ali Velshi's even got a couple years on your old pal Jake. So I'm sure he's going to continue doing that slip up in this interview. And I'm also sure no harm is intended. It's an honest mistake. That said, this is a perfect example of the way the right treats people when they can get away with it. They are not interested in the intent of the law at all. They will use what rules they can to harass who they can to distract from their various corruption scandals. Both these ladies up there are quite heroic, and you need to understand they are risking legal consequences in the course of this interview. Be on the lookout for them and be prepared to go out into the street holding a sign and saying you're not happy about it if the gavel gets swung in their direction.
Oh, absolutely. And that's not something Alabama is shy to, using laws to incriminate or incarcerate people that when the law wasn't even intended for that purpose. And I really think it's necessary to point to the ways in which this state incarcerates and kills its marginalized and lower income communities. And that's definitely one of the ways that the state aims to pit people in the carceral system.
Robin, there is a distinction between when I was talking to both of you, the targeting of doctors, nurses, abortion providers, healthcare workers, and women who actually take the abortion pill or seek abortion, health, reproductive services and abortions. How important is that distinction to us? Should my viewers be understanding that this is yet another step, or is it all the same? Is it all the same thing, that whether you target doctors, nurses, healthcare workers, abortion providers, or the women themselves, it's the same thing?
Well, what's necessary for everyone to understand is that now that we are in an age of medication abortion, it is possible for a person to be able to manage their own abortion without any sort of medical intervention, any sort of assistance. A person can go to a website like aidaccess.org and get medication and have it sent directly to them, even.
Point of clarity, just the way she speaks, I keep hearing aidaccess.org. The link is in the description. It is aidaccess.org. And kudos to her for dropping that plug a bunch of times for people who might be in a desperate situation, and this is the only way out. Link is in the description. If you know somebody who is in one of these oppressive states, there is a way they can still get an abortion, even though one of their fundamental rights was revoked by the Supreme Court.
If it is illegal in the state, a person can manage their own care without letting anybody know. And if a person has a complication, they can go into a clinic like mine, or they can go to a hospital and simply say, I am pregnant, I'm having a miscarriage, and I'm scared. They don't need to let people know about their abortion. And this is terrifying for lawmakers because they've gone through and said, okay, we are never going to punish the person who is getting the abortion. But once you remove everybody else, there's no one to punish. And now that it is easy for a person to be able to do this on their own, they need someone that they can frighten, someone that they can try and threaten. Otherwise, people will just autonomously do it by themselves, as they should be able to.
And Janice, the issue.
Do bear in mind, 60 years ago, the way of doing it by themselves were the horror stories that you hear about so often. The coat hangers and bleeding out in an alley somewhere. This is this abortion pill is a safer way to run that same civil resistance, frankly. The fact that it's good that we have this medication. It's good that science once again is pulling more than its share of weight in terms of keeping us living some semblance of a civilized life. But don't make the mistake of thinking that there's nothing else wrong with this situation. The fact that we are essentially back 60 years in terms of social progress is deeply depressing. And we should not let it stand. We need successive generations of politicians to be elected who, give a damn about people who can get pregnant. It's that simple. We need to get essentially the farthest right people in office being Democrats. Republicans are doing everything they can right now to ensure that the future is Democrat and farther left. But the present, there's a lot of damage being done that we're going to have to work to undo.
Is that this does frighten people, right? When we were talking about this, not everybody follows this story every day. And if you hear from someone a lot of women have abortions that they were not planning to have, or seek abortions that they were not planning to get, and they're not fully read in on the whole thing. And if the word gets out there that you order this pill, you get this pill, you take this pill, you can go to jail, it's half the battle.
It is. And I think that's sometimes what people rely on when they're trying to scare people, right? Is that folks don't have the time to research and know this information. And like like Robin said, people will get scared, with certain things that happen after you might self-manage and might go to the hospital and say, hey, this is this thing that I've done to self-manage, not knowing that you don't have to disclose that there's nothing that looks different from if you self-manage versus having a miscarriage. I think a lot of the problem is fear, and I think that's something that we need to have the conversation about as often as possible in a way that's protected by our First Amendment, right? Because that's another thing that people are even scared to do and have the conversation in public spaces, but we have to so that people know what they can do.
So, the right using fear to control the population. These shows, I don't set out to do a theme in each stream, but maybe I should just look for the through line beforehand, because there absolutely is in every single one. In this case, it's fear and the right's relationship with it. It's spooky how comfortable Republican politicians are with just the ugliest behavior, the most despicable terrorizing of the populace that they possibly can get away with. They will not hesitate to throw a teenager in jail if she doesn't want to have a baby. She's afraid of childbirth because she's a kid herself, and she gets an abortion. Kids are smart, though. So if you're out there and you are in one of these states that thinks it's The Handmaid's Tale, or rather that thinks The Handmaid's Tale was a happy story, then aidaccess.org. Links in the description. If something does go wrong, and my understanding is that's a rarity, but if something does make you nervous, you can go to the doctor and you don't have to tell them anything more than, I'm pregnant, I think I've miscarried, I'm scared. That's it. They ask you what happened, you say nothing. Because you don't have to say anything.
That's a very interesting question, First Amendment right, because when I was in Alabama last summer, Robin and I went to her clinic, and I asked this question about what you're allowed to tell people and what you're not allowed to people as it relates to medication abortion. Let's just play a little of that, Robin.
I hate to preempt because they're about to go right into it, but I do want to jump in before they say it. When you're listening to this, understand that this woman is on here now advocating for aidaccess.org. This is the one good thing about all the horror that the right has put upon the U.S. It has forced people to stand up. Let's look at what she was saying a couple months ago.
If I walk in here and I see you, you're wearing a shirt that says medication abortion is extremely safe and effective. Mm-hmm. And I say, can I get some?
No. I can't say anything. If I were a regular person, I would say something like, a person can go to aidaccess.org and obtain medication abortion without needing a prescription and have that shipped to them regardless of whether it is a legal state or an illegal state, but that person is running a lot of risk of surveillance and should be very careful. That would be something I could say if I were a regular person. I am not a regular person, so I cannot say that to a patient. I cannot say that to anyone. Honestly, wearing this shirt is a risk, and I do it on purpose because I know that this is one way to make a conversation happen and make people think about this.
Remember, she said, I can't say that because I'm not a regular person. She's a medical professional, and these states have passed laws to target medical professionals. Why? Because it looks less bad than throwing that teenager in prison. Instead, they terrorize the doctor of that teenager. Now let's listen to what she's saying after they keep pushing.
Robin, has anything changed since that conversation you and I had in Alabama?
Yeah, we're telling people where they can go to find pills. We're not telling them explicitly that they can go to aidaccess.org. We're leading them to First Amendment protected websites that have information for them. We're letting them know that there are places that are safe places. We are letting them know that we can provide ultrasounds if they are considering an abortion. And while we can't help them have one, we can give them an ultrasound that will let them better understand their choices. Because the Attorney General has said that he is coming after pregnant people. And throughout all of this, that is who we have been trying to protect by not pushing the line. If he's coming for them anyway, then we're going to go ahead and test the lines.
And Janice, again, Robin, there's some things that Robin is constrained from telling people. Hero. Of course, we're not, so I'll tweet it out and let people know. But is this fight going to be successful? Are national organizations or regional organizations like yours able to fight back against this on a national level?
Oh, absolutely. I think one of the things that we were optimistic about at first was maybe there would be more safety nets, right? We're waiting for those exclusions and all of those things. And when it didn't happen, I think there was that immediate realization that, okay, we're just going to have to take the risk because this is an actual death threat. This is a state with the third highest maternal mortality rate. Like, this is a state that did not expand Medicaid, but it has 900 million for prisons. So it's very necessary to mitigate the risk, but it's definitely something that we have decided is, okay, what are we going to do about this? We're going to tell people where they can go because this is life or death. It's literally life or death for folks.
I mean, when you look at history books and you see little paragraphs for the lesser known heroes in the civil rights movement, that's the kind of people they were. And that's the kind of people those two guests on Ali Velshi's show are now. They're heroes. They are risking their own well-being to help others. Don't let them stand alone. Keep your eyes open and ear listening for news of those two and for doctors in regressive states that are being harassed and targeted. In the meantime, if you are pregnant and you do not want to be, and you live in an oppressive state, you can go to aidaccess.org and get medication abortion. My understanding is it does not require any prescription. And I will tell you, as they said, if something does go wrong, if that's a concern of yours, and you want to go to a doctor and make sure you're safe, you're healthy, you can simply do so. And you do not have to tell them about the fact that you went to 8 Access and that you were forced to do that. I wish you luck, and I hope for better days.